With the increased supply, Illinois is now averaging 100,000 vaccinations a day. That's about 1% of all adults in Illinois getting a shot each day, and I expect that number to continue to grow in the weeks ahead. Based on current projections, we expect that that number will surpass 1 million doses in April. The Biden administration has met or exceeded all of its vaccine projections to date, and I have every confidence that they will continue to do so. That's why I'm pleased to announce that I'm directing every jurisdiction that receives allotments of vaccine through the state of Illinois to expand eligibility to all residents 16 and older on Monday, April 12th. Additionally, to ensure our more vulnerable residents are prioritized, Dr. Ezike and I will be announcing additional populations who will be made eligible for vaccination prior to April 12th in the days and weeks ahead. By mid-April, we will be at a point where dividing up the population into phases won't make sense with the ever-increasing supplies that we expect to see. President Biden set the bar for opening eligibility to all adults nationally on May 1st, and his administration has been quick and decisive to allow Illinois, for example, to hurdle that bar 2.5 weeks earlier on April 12th. As a reminder, because of the steps that Illinois took, our state never ran out of hospital beds or ventilators or doctors to care for patients, even when other states did. It's time to begin to cautiously move toward normalcy, and it's imperative that we do so in a way that maintains all the progress that we've made to date. That's why moving forward, Illinois will advance towards normalcy with a dial-like approach, allowing us to dial it up as things are improving. Over the year, we have progressed from phase 1 to phase 4, and we're on the verge of the ever-elusive phase 5. The first move forward will be into the bridge phase, a transition period with higher capacity limits for businesses and gatherings. This will allow Illinois to restore normal operations faster without ignoring the risks attendant with the new variants that we see rising around us. Barring any significant reversals in our COVID-19 hospitalizations and deaths and cases, Illinois will move into this bridge phase when 70% of our 65 and older population receives at least one dose of the vaccine. I'm optimistic about reaching that milestone because as of this morning, that number is 58%. So after a 28-day monitoring period in the bridge phase, and assuming no significant resurgence of COVID-19 cases, hospitalizations, and deaths, Illinois will resume normal business operations when at least 50% of our 16 and over population has received at least one dose. As of this morning, that number is 28%. In short, we are able to make these significant moves forward toward normalcy because people will continue to be required to wear masks in public when they can't maintain proper social distancing. So Illinois will lift its face covering requirement when the CDC recommends it.